Okay, so let's look at how we can apply some of the major moral theories to this issue of when paternalism is justified. So the act utilitarianism, the act utilitarian is generally going to be more in favor of paternalistic actions than the Kantian. So according to act utilitarianism, paternalism is justified if the action maximizes overall well-being. So this does tend to be more inclined to permit paternalistic actions. And For example, according to the utilitarian, it's okay to lie to a patient if it does increase his overall well-being. So most most bioethicists generally reject act utilitarianism in normal circumstances. On the other hand, we have rule utilitarianism, which basically says that an action is right if it conforms to a rule that maximizes well-being. So we're looking at whether the rule or policy is justified. So a rule in one case might be, you can lie to a patient if it makes him feel better. And that might be justified under act or rule utilitarianism if the general adherence to that rule would produce overall better consequences. Now, in certain cases, like a pandemic, bioethicists generally favor more of a utilitarian take. Maybe not completely, but more of a utilitarian take because a pandemic affects everyone. And so policy for resource allocation would be based on whatever allocation would promote the most overall well-being, which would include saving lives. About how paternalistic the policies should be are going to vary. So in some countries, they might require a mandatory lockdown, where if you go outside or start walking around, you could be arrested. So that's a highly paternalistic rule. But other countries, you're not going to see that as much. That's less paternalistic. So Kantianism generally favors autonomy because respecting people, which is one of the basis of Kantianism, involves recognizing their autonomy. So an action is right if it respects the person and is fair. So generally, Kantians are going to be a little bit less in favor of paternalistic actions than utilitarians. Okay, so let's move on to the other topic of committing psychiatric patients. So remember that paternalism, or the principle of autonomy, says we should treat autonomous people with respect, and paternalism may be justified when the person is not autonomous. And this relates to psychiatric patients, because psychiatric patients during certain times, certain episodes or whatever, may lack autonomy or lack autonomy enough to justify paternalistic actions. But real quick, we'll talk about a couple legal cases, some legal victories for psychiatric patients. The first is Wyatt versus Stickney in 1972. So this case established that a committed psychiatric patient, they must receive treatment or be released. So if a patient is going to be committed, or in Florida, Baker acted, they have to receive treatment. This helped establish criteria for minimal treatment. So if they're going to be committed, there has to be some minimal amount of treatment that's performed. Another case in 1975 is O'Connor versus Donaldson. And this established two requirements for involuntary commitment of a psychiatric patient. One is that they must be suffering from a mental illness. The other is that they have to be dangerous to others or to oneself, where dangerous means imminent risk to life or bodily harm. Later, some states added a third requirement, which is the provision of the least restrictive environment by the institution. So, for example, if somebody is committed and they don't really need to be in a straitjacket, then they should not be in a straitjacket. So only restrict the environment to the extent that is needed to prevent harm. Lastly, an interesting issue arises when it comes to psychiatric patients and paternalist actions directed toward these patients. The question here is, can paternalism actually make people more free? And what's interesting is that paternalistic actions are generally at odds with somebody's autonomy. But there could be cases in which a paternalistic action could promote a patient's autonomy. So, for example, forcing patients with schizophrenia, which is a paternalistic action, forcing them to take their medication, for example, may actually aid them in gaining autonomy. Because if they didn't take their medication, they become psychotic. That undermines their autonomy. So perhaps in some cases, paternalism can help somebody be more autonomous. So I'll quote Paul Chodoff here. He says, is freedom defined only by absence of external constraints? That's the negative conception of freedom. Internal psychological or physiological processes can contribute to a throttling of the spirit that is as painful as any applied from the outside. So the basic idea is that there are sort of internal constraints, like psychosis, for example, that may inhibit one's freedom. The wild manic individual without his lithium, the panicky hallucinatory without his injection of whatever, and the understanding support of a concerned staff, the sodden alcoholic, are they really free? So the issue here is that sometimes, arguably, forcing treatment, which is paternalistic, may help the person become free. So these are interesting cases because paternalism may, in some cases, not be at odds with autonomy. All right, so that's it. Thanks for watching.